day. I'm Carmela Alavazo, and I'm 45 years old and currently working as a call center agent at Icar Clark in SM Pampanga. And I'm here now, here at CSA Medical Aesthetics. And I am so excited kasi may nabanggit sa akin si Doktora na bagong treatment. Siyempre, as a 44-year-old working mom, we're not getting any younger. So lahat nagiging sagi na, nagiging kumukulubot na, especially sa ating face. Yan, considering na ang ating mukha ang ating pang-front sa mga tao. Kaya na-curious lang ako dun sa binanggit ni Doktora Contessa about sculptra, something like that treatment. And excited ako kasi nasabi niya na itong treatment na to, it will give some volume on your face. Kung makikita niyo yung aking mukha, ang tawag dito, ang dami ng mga wrinkles, tapos nagsasag na, as in bumababa na yung Kasi, syempre, pag tumatanda ang isang tao, hindi na ganun ka-elastic ang kanyang skin. So, why not try this treatment and let's see kung anong magiging outcome nito and result nito after this treatment. Hopefully, makaakit pa tayo. Pero hindi, syempre, akitin natin ang ating only one. Parang ganon. So, hopefully, after this treatment, everything will make my face younger. Parang ganon. So, tara na. Try natin itong sinasabi ni Doktora na sculptra treatment. Please don't forget to subscribe and click the notification button so you will be posted with the new trends dito sa CSA Medical Aesthetics.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we will be doing a sculptra treatment. Before that, let's all welcome, for the first time, Ma'am Carmela.
Hello po, Good morning po. Good morning, everyone.
Yes.
Welcome to CSA.
And Carmela is in her 40s, right?
Yes,
She's
po. 45 to be exact.
To be exact. 5 years younger than me. And actually, she's my younger sister.
Hello
Okay? Yan. We're kind of look alike, right? Because some people, like sometimes they thought I'm her, they thought she's me, something like that. So, we're here with Carmela, okay, to be doing a so-called sculptra treatment, which is an anti-aging treatment or something that will also prevent or delay the aging process. So before we do a treatment like that, it's significant to start with the so-called assessment of the face. So for Ma'am Carmela, okay, so she's already in the 40s. Okay, we know that aging starts 30s, or right now it's around 25, okay, when we start to lose some of our collagen, some of our elastin, hyaluronic, and especially nowadays, It's kind of like a stressful lifestyle nowadays. So the aging process is already beginning in that age of like mid-20s. So for Ma'am Carmela, okay, so assessment. Whenever I do it, I divide the face into 3 horizontal divisions. So upper third, okay, looking at the upper third, okay, we see some fine lines and wrinkles on the upper third, the forehead region, the glabella. And when she smiles, smile. Some of the so-called crow's feet, okay? And on the temple region, we also see hollowness already, the volume loss, okay, upper third. So middle third of the face, so we look at the infraorbital region, so there's also a volume loss, sunken under eye, the so-called tear trough, and a beginning mid-cheek groove or the volume loss. So if you look at the profile view or side view, a beginning flattening of the mid-cheek region or the anterior-medial cheek aspect of the face. Ideally, we want it to have that good convexity, that good OG curve, okay? So also in the mid-face section, okay, we also look in the zygoma region. Zygoma is very good, but below that, inferior to that, there's already a depression, a volume loss also, okay? And in the mid-face section, if you're gonna assess that, there will be a beginning sagginess. If there is like continuous, this part here, weakening of the zygomatic ligament there, so there will be some sagginess. So that's in the mid-face section. She has a good nose profile actually. She has the best nose in our family. You're blessed. Okay, lower third of the face. Okay, if you're gonna assess on the lower third, okay, so from the subnasal region to the chin part, okay, perioral region. So there's also a noticeable beginning nasolabial fold and a volume loss also on this aspect, extending to the subzygoma area or preauricular region. And then a bit loss of jawline definition and somehow a sign of having that jowling there. Okay, and the chin is, well, it has a good proportion. The so-called 1:2 in terms of the projection. It's also good. So for her, actually, the focus is volume restoration because she has this subzygoma depression plus this inferior part of the cheek, some volume loss here. And also, we want to correct the hollowness on the temple, and we want to also do kind of like a lifting benefit there. And the thing is, the one that we also check, the skin quality. Okay, when you pinch the skin, okay, so there's a beginning like skin laxity, okay, so the elasticity of the skin is starting to disintegrate, okay, when our skin has this elastin fibers, so when you have the elasticity, when you pinch the skin and you release it, it goes back to its original position in a faster rate. So pinching the skin like that, so you should feel some firmness, tightness of the skin. So a beginning kind of skin laxity already. So we want to do a treatment that will, of course, restore the firmness of the skin, the volume, and at the same time that lifted and good curves or convexities of the face. Okay? What do you think? You're
wow.
excited? Yeah, just a wow, okay? So actually, we will be doing a treatment that will be very beneficial for her, and she's also busy with her work, okay? We want a treatment that has, as much as possible, no downtime, okay? And a treatment that will give a natural result. She only wants something natural. And there's a treatment, but not looking unnatural, okay? And of course, we want to reverse the aging process. We want to restore collagen, elastin, and even glycosaminoglycans. Okay? So, we'll show the procedure when CSA Medical Aesthetics return. For the new reconstitution protocol of Sculptra, we'll be needing 1 vial of our Sculptra polylactic acid. We'll also need syringes, a 5 ml sterile syringe, a 3 ml sterile syringe, a 1 ml sterile syringe, as well as this single-use 18-gauge needles. And also, we'll use the sterile water for injection and this lidocaine for injection. And to start with, it's gonna be a 2-step protocol. So you'll be opening up this 1 vial of your Sculptra there, and you have to aspirate 5 ml of your sterile water for injection. So this is the first step. And once you filled in your syringe with this 5 ml of your sterile water, so looking at your 5 ml syringe, and then recap that, okay? And we need to clean the rubber stopper of our Sculptra vial here. And we'll be using our gauge 18 needle. Open that and use it with your 5 ml syringe. So we can check if it's a 5 ml. And then insert it into your vial of Sculptra. And you can push slowly onto the side of this vial. And after we had filled in with the 5 ml of our sterile water for injection, we have a Sculptra mixer here, okay? We'll put it in here and snap it. So snapping our vial of Sculptra, and switch on the button here. And we need a minute to dissolve the particle in that sterile water for injection. So 1 minute. So after a minute, let's check the vial of Sculptra and make sure that your powder Sculptra was properly dissolved in your diluent. So if it's already a homogeneous suspension, then we can add, for our step 2 protocol, a 3 ml of our sterile water for injection. So use this 3 ml syringe, aspirate your 3 ml of sterile water. So once you filled in this 3 ml, then we need again another 18 gauge needle. And clean again the rubber stopper. And we can insert here and push again our 3 ml of sterile water. So the reason that it's a 2-step protocol is that we wanted to have that available space for our particles to really get dissolved in our vial of Sculptra. So push this 3 ml, and after this 3 ml solution, we can again mix our suspension using the Sculptra mixer. Okay, so put it back again and snap it, and we'll just use about 15 seconds to mix this. 15 seconds. So after the 15-second mixing of the 3 ml and 5 ml, now it's optional to add your lidocaine. We can make use about 1 to 2 ml of our lidocaine, and the reason is to help minimize any discomfort during the treatment. Okay, so 1 ml of this, aspirate, and we can infuse it into our Sculptra. So we can use again our 18 gauge needle there and infuse it into this rubber stopper here. Okay. And this one, it's optional to use the mixer again. You can actually just shake it like this. Just make sure you mix the solution. So the goal is to have this homogeneous suspension here, making sure that all the particles were dissolved in your diluent there. So you can use either a 1 ml syringe or even a 3 ml syringe or even a 5 ml syringe during your treatment injection. So for example, I'll be using a 5 ml. So I need to aspirate this vial of Sculptra. So since I have a total of 9 ml here, so I'll have a 2 5 ml syringes for my injection. So aspirating, I'll be getting a 4.5 ml of my product. So we now have this 4.5 ml of the Sculptra ready for injection. This one here. And we are back. So we'll be doing a so-called assessment for Ma'am Carmela first. So upper third of the face, okay, we will delineate. Okay, upper third is from the trachea to the eyebrow area. Okay, so this part here, upper third, and then the middle third. So from the ala to this part here, and then your lower third of your face. So for the part here, we'll also do like a marking for our temple region. So we also want to correct the hollowness on the temple region for Ma'am Carmela, right? Then we palpate for the superior border of the zygoma here and the lower border of the zygoma here, okay? And then we have a vertical line. So can you clench, please? So delineating the anterior border of your masseter there. So we have a so-called masseteric cutaneous ligament here. Now, what we want to correct for Carmela is this volume loss in the temple region, as well as this volume loss preauricular region, and also a volume loss here on the lower cheek part. She has a good zygoma bone here, okay? Good. We have a good cheekbone area. So we want to focus temple, preauricular, and the lower cheek region. And of course, somehow improve the laxity of the skin, okay? So what I'm gonna do is I'll be using a cannula method here. So one entry point here to go towards the temple region there. So it's gonna be a fanning technique. And then I'll be using the angle of the jaw here as my entry point to go towards this preauricular region. So we need to fill this in, okay? And to correct this part, the lower cheek region, we can make another entry point there to correct this part here also, okay? So these are the areas that we need to focus and also correct, okay? So same thing on the other side. You have any questions, Ma'am Carmela? You're good? Because a while ago she was concerned, is it painful? Okay. So before doing any procedure, of course, you clean the area and apply a topical numbing cream. We did apply an anesthetic cream, leave it on for about 45 minutes. And then, so we did our marking already. We're gonna cleanse the skin again. So before any treatment, any injections on the face, it's significant that we totally cleanse the area, sterilize the skin, okay? And we had removed our markings. So for now, we'll start with correcting the temple, okay? So we need to restore that good temple volume, okay? So I have my zygoma region here. Turn to the opposite side, please. And my entry point will be here. I'll use a lidocaine injection, just a tiny injection in this part, creating like a tiny papule only, okay? Inhale, exhale, okay? It's just the lidocaine that has some this stinging sensation. Okay, there you go. So I need a gauge 19 or gauge 18 needle or gauge 21 needle to make an entry point there. So you can pinch the skin and also make your entry point there. So rotate your needle so we can remove this and place it there. So the Sculptra that we prepared a while ago, a 4.5 ml, you can even use a gauge 25 cannula, okay? Then we're gonna make sure that it is primed, okay? Now, make a perpendicular approach initially in your entry point there, okay? Perpendicular initially, and once you have your tip already inserted in that entry point, we can already go towards the temple region. So this is in the so-called subcutaneous plane or layer 2. Okay, so advance your cannula towards the hairline region. when you're using a sculptra, we need to avoid, okay, forehead and near the lateral canthus. So those are no-go zone for your your sculptra injection, okay? So advance towards the hairline there. There's a space here, okay, that we can sense when we're inserting our sculptra there, okay? You're good. Then we can also inject towards the temple fusion line there, okay? So some sensation, gritty sensation. So if there is some fibrosis already inside, it's normal to feel some resistance there. So again, I'm using a cannula and delivering the product via so-called fanning method. So advancing it again. And Ma'am Carmela had some acne scars. Okay, so when we have patients with these acne scars, expect some resistance whenever you advance your cannula there, okay? So we wanted to place also this sculptra here in this section, avoiding the crow's feet area. Crow's feet you can correct with your neuromodulators, okay? So we want also to improve the volume here in this section. So in one strand, you can actually use about 0.3 of your product there, because we're gonna use the 4.5 ml on the right side of the face, okay? So I need more on this upper part here. Make sure you distribute the product evenly, okay, just to have that balanced distribution of your sculptra product. Take note, sculptra is a biostimulator. It helps restoring your collagen. It will stimulate your fibroblasts to synthesize new collagen particles or new collagen protein fibers, okay, as well as our elastin. So immediately after injecting it, you have to do a massaging to spread the material. So my next treatment area will be the so-called pre-auricular region to correct that subzygoma depression here, okay? Now, entry point for this one will be the angle of the mandible here. So that will be our landmark, okay? So again, so disinfect please. So it's important that we remove any hair in the way. So disinfect, and then we can anesthetize the entry point with our lidocaine inject. So I want to correct the subzygoma depression there. So this is a lidocaine here, and then we'll use our introducer needle, a gauge 21 needle. Since we're using a gauge 22 cannula, okay, widen it. Okay, so pull out. There you go, and I can direct it there. Since we're using a gauge 22, so I suggest we use a gauge 19 introducer. Introducer is gauge 19. Okay, so once you have your cannula tip inside that tissue layer, glide your cannula towards this subzygoma depression here. So I'm really expecting resistance because she has acne scars. Okay. So the good thing with the treatment, it will already help in improving that problem of acne scars, okay? So we're treating the skin laxity at the same time we're also treating your acne scars. Okay. So it has a lot of advantages. Apart from improving the quality of the skin, we're already treating our acne scars. Okay. So we can direct into that preauricular region. We want to also improve this depression here, and we're gonna further improve towards that medial aspect of our preauricular area, okay, gliding and advancing our cannula. So we have to proceed now with the correction of this portion here So in our lower cheek section, anterior part. So I'll make another entry point for this area here for me to reach this part here. So my entry point will be anterior to the first one but a little bit higher, and I'll make my injection of a lidocaine papule. So just a lidocaine here, a minimal one, and then we're gonna use and we're gonna like inject and make a wide opening for that one. Okay. So pull out and hand me the product. So I still have a like about 1.1 of my product here to correct this inferior part of the cheek, medial aspect. Okay, so the cheekbone area, the zygomatic bone is already good, so these are the ones we need to correct. So again, expect some resistance because of those adhesion bands from your acne scars. Okay, so during the teenage years of Ma'am Carmela, she also suffered from acne. Correct, Ma'am? Yeah, I can hear some of the cracking sound here. Okay, so improving that. Some cracking sound, and so there's an advantage already while we're doing this kind of treatment. We can include the correction of acne scars. Okay, it's like doing a subcision already. Okay, some resistance there. Okay. So again, when you do your sculptra, no-go zone, forehead, nose, periorbital, perioral. Okay, so we can do this anteromedial cheek part here. And we can also do superior jowl part there and even the jawline. Or you can even reach the marionette or the pre-jowl area. Okay, so I'm almost finished with this remaining ml of our sculptra. Okay, some pushing of our product. Make sure you spread the material in an even fashion so that we can avoid any problems of lumps and bumps or nodules. So the particles are equally distributed in that anatomical layer we call layer 2 or the subcutaneous layer. Okay, so we're done on the right side. We'll proceed to the left. And then we're almost done, and I have done our last ml of my sculptra. We'll show the result to Carmela when CSA Medical Aesthetics return. And we're back, so we'll now show the result to Ma'am Carmela. Here's our mirror, Ma'am Carmela. So we did sculptra injections for Miss Carmela. We worked on the right side and the left side. We work on the temple, we work on the preauricular, we work on the lower cheek regions to correct volume loss as well as improve the skin laxity. So Ma'am Carmela, what do you think?
Super light, Doc.
Yes.
Ang ganda.
Yeah. I can actually see an instant result right now with the help of this sculptra treatment. So what the sculptra is doing is that it will stimulate your collagen production and it will restore that good skin quality, and over time you'll still see more improvements with it, right, Carmela? So how was the experience? So far so good? Painless? Some discomfort?
Yeah.
But it's tolerable.
Yeah, sabi nga, no pain, no gain.
No pain, no beauty. That's what they say. Okay, so this is a kind of a treatment that we can do like during your break, when you're like off from your work. Okay, so we do a procedure that is kind of like easy technique, okay? We use cannula method, and we delivered it in the subcutaneous plane. And as much as I can see right now, I don't see any sign of bruising, okay? So Ma'am Carmela can still work tonight because she's working graveyard, right?
Yes.
Yeah, there you go. And the thing with the Sculptra is that it's working gradually from within. It will stimulate your fibroblasts to synthesize new collagen and elastin, and also your glycosaminoglycans will be restored. So it's working also in your dermis layer and restore those natural connective tissue matrix, rejuvenating your face from inside and seen on the outside. And the thing with the Sculptra is we also do like a repeat treatment for this one. Like we can do another session for about 4 to 6 weeks, or to complete that 3 sessions protocol, okay? And then as time passes by, years pass by, you'll see more improvement. Because this poly-L-lactic acid you find in your Sculptra, actually, it lasts about 2 years. The effect of that is lasting 2 years. So the microparticles of your poly-L-lactic acid will stay in that dermis and subdermis region and working inside and stimulating all those fibrous network of our tissues, rejuvenating you as time passes by. Plus, I love the natural result, right? Yeah, you've done something but you don't look like a natural. You don't look, or it's not really that obvious, but there's something going on inside, and gradually people will just notice that, oh, you're looking refreshed, rejuvenated, and you'll have that youthful glow.
Wow.
Okay? Do you have any questions, Ma'am Carmela?
None so far, Doc.
Yeah.
But
Usually, like when we do procedure after this, we give you like a post-procedure instruction. So what to do after the treatment. We advise you to do massaging of the treated areas like for 5 minutes, 5 times a day for 5 days. Okay? You can do cold compress also after the treatment. The following days, some tenderness in the treated areas, but that one is very tolerable. Okay? So basically, that's it. Not much of any other like very special, hard, difficult to follow instructions, home instructions. And we advise also follow up like for 4 to 6 weeks. You can do the treatment again. Okay? So thank you so much, Ma'am Carmela.
thank you so much, Doc.
And thanks to you all. If you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, our Instagram, CSA Medical Aesthetics. Ma'am Carmela, do you have any FB or Instagram if they want to ask some questions about the treatment? Carmela.
Yeah. You can ask me. I have my FB, melalabazo@gmail.com.
Yes.
Amazing. Very good. Thank you, Doc.
Yeah.
And thank you, CSA, for this opportunity. And Sculptra as well. Very good.
Yes.
Yeah.
Amazing results. Okay. And please do watch our other videos in our YouTube channel. Just type Contessa Salvador, and please click the like and the subscribe button.
Yeah.
So, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.